Welcome back to Credentialing Chronicles, where we spill the doctor's tea hotter than your morning coffee.
And give you the insider scoop on the wild worlds of credentialing, provider drama, and everything they don't teach you in med school.
I'm Shannen, and she's Nyleen, two credentialing pros with front row seats to the chaos, looking to make you a part of it. Yes, we want you to engage in spilling this tea with us. We need your love and likes, and we want to know what you think too. Look for us, please, on LinkedIn, Instagram, and yes, baby, even TikTok.
Yes, we love to see your love. From fraud scandals to burnout breakdowns and why your favorite surgeon might actually be banned from 5 hospitals.
Honey, we've got the gossip and the practical advice to keep you out of trouble and ahead of the game.
So grab your coffee, your compliance checklist, and maybe a lawyer, and let's get into it.
Hey, Nyleen, how are you, beautiful?
Hey, Shannen. Good. How are you? Nice to hear from you. What's up?
I know I missed you so much. But have you ever seen a headline so wild you have to read it twice? Because I did. I was seeing United Healthcare was sued by their own shareholders after executives. The guy that was murdered. Remember the CEO?
Yeah. The CEO.
Yeah. Luigi. Yeah, he's like on trial for it. And their stock crashed after that, and that's not even the plot twist. That's like a Netflix limited series waiting to happen, I guess. But
oh, girl, I know everything was going on with that story. It was like murder, Medicare, money, mayhem. Like you could call it Grey's Anatomy corporate edition. So, I mean, United Health Group, right? That's like the one probably managing our grandma's Medicare Advantage plan. You know that one? So like you said, yeah. So yeah, you said they sued the shareholders, which are the ones that are interested in making all the money, right? Which if their stock crashes, then they're super mad. So what happened? Tell me the reason.
well, after their, CEO Brian Thompson was shot and killed in Midtown Manhattan last December, right? So we're almost going on a year. The company started quietly changing how it handled claims. And so we know, they're always big for denying first, right?
Tell me about it.
I know, right? I know. That's why I paused because I was like, I know she's going to say something. But they backed off those hard denials, using those tactics that made them a target for the investigation through the Senate.
I want to know how they were doing that because I got like 6 denials in the last month. But anyway, okay, so they're trying to play the nice guys now, but go ahead.
I guess they were now not denying all of the claims, right? I don't know. But after the Senate started investigating them, the ones that say United Health, they were denying way too many patient claims. And so I guess that's why they got sued.
So they went from like a corporate pit bull to like all of a sudden they were just accepting claims and not denying as many as they had to. So they went to like a patient friendly poodle. So wait, so here's the shady part. So they didn't tell the investors that it was a good thing to be nicer to patients because that might hurt profits. So when the numbers dropped because they weren't denying enough claims, whether it was on purpose or rightly do so or not, that's when the investors lost it?
Lost it. Okay, so picture this. We're talking April 17th this year. Stock drops 22.4%. We're talking dollar amount, 119 billion. Nyleen, just gone. Billion, not with a B, not even million. Okay. I mean, it's like a corporate cliff dive, to be honest. And I guess the stockholders are pissed. And I guess they're saying that money went to pay claims, which shouldn't the money go to pay claims?
Yes. Oh my goodness. And so, of course, the shareholders are suing now, saying that the company lied and then inflated its stock value by pretending that everything was fine, even though inside they were trying to control the whole PR fallout and literal murder of someone.
Literal murder. Yeah, yeah. And so instead of saying like, hey, maybe this is a wake up call, maybe we should start doing things right, which I kind of feel like they did, but the stockholders are getting mad. So let's not forget, right? The guy accused of killing the CEO, Luigi, sorry. Like
Thompson,
Mario's,
the
yeah.
Luigi.
Luigi
Luigi Mangione.
Mangione.
Mm-hmm.
I mean, if that is not an Italian name, right? Has pleaded not guilty, honey. And I know I've been following this, and the judge took away the terrorist, so it doesn't fall under there anymore. But social media has went wild because some people are actually starting to call him a hero, right? I mean, you've heard that, right?
Mm-hmm. Absolutely.
Mm-hmm. Yeah. And so now we're not just justifying anything, but that says a lot about how angry the public is, that our insurance companies are just being used, right, for profit and denying actual treatments that people need.
They are. And it's getting to the point, Shannen, that before they even pay me, and this is United Healthcare is number one for me in my practice right now. Number one, they aren't even, sometimes they pay and then they ask for medical records after, whatever. But now they are wanting me to send all the medical records before they even justify a payment, either so they can force me to down code, right? Or not approve the services that we've already provided to the patient. So now I don't even know if we're going to get paid, even though we went through the prior authorization, even though the doctor did actually see the patient. So they're actively denying. So I'm surprised that they did this to so many claims. But anyway, this is all giving me like a corporate villain origin story. These companies spend millions denying claims. Yes, they spend time, literally just today we're going to deny all GI claims. Today we're going to deny all ortho claims. So they spend money denying the claims, doing the lobbying. But when patients suffer or die waiting for approval, nobody's accountable. Then suddenly a CEO gets killed and now there's outrage and lawsuits flying everywhere from both directions, one direction and the other.
And oh my goodness, I just don't even know at this point. And let's be clear, right? This case isn't about the murder itself. It's about the money. It's always about the money.
The money.
Always. The shareholders say that United Health, the company, and its execs, including the CEO, Andrew Whitty, I guess he's the new CEO, and the CFO, John Rex, hid how those policy changes and the public's backlash were wrecking profits. But I don't understand, isn't the writing on the wall that that's going to wreck profits? There's going to be a dip?
There has to be. You have to prepare for something like this to happen. So, I mean, I know we had to do this current events little thing, but we still need a little PSA for the professionals listening, especially in credentialing and compliance. This right here is why transparency matters. When your corporate leadership hides data or sugarcoats the fallout of a crisis, it doesn't just affect the investors, it destroys trust from patients, providers, and the public.
I know that we were trying to get Dr. Elizabeth Potter. She's an Austin-based plastic, yes, we're trying to still get her. But she is literally having the same issues with United Healthcare. I mean, it all stems back to United Healthcare. And for patients, I mean, especially anyone that's on a Medicare Advantage plan, this should remind you to read the fine print, right? United Healthcare is massive. And when companies this big change claim practices, it affects millions and millions of patients, doctors. I mean, it's affecting Nyleen, you all. It's affecting Nyleen.
Of course. We spend more time and money trying to appeal for our stupid $100. And another thing I want to say for patients, right? When you get rid of your Medicare plan and you choose to go with an advantage plan, that is not to give you an advantage, okay? It is because you are literally paying them, and it's not you. Let me tell you who's paying them. The doctors that you are going to see, okay? The doctors are paying. And I'm going to give you a perfect example of what happened to me the other day. Same brace, okay? Same boot, same CPT code that I use to bill out a boot, okay? I bill Medicare. Medicare pays me $700 in reimbursement, okay? For that boot. Age of a patient with a Medicare Advantage plan, okay? I submit the bill. Do you know how much the Medicare Advantage plan pays me? $300. Who keeps that $400? That is per claim, patients, per claim. Who kept that $400? That Medicare Advantage plan, because that's you as the patient taking it away from the doctor, okay, or the doctor's office. You just paid them $400 to manage those services for you, because that's how they give you the quote unquote free $25 for medicine for that month, or whatever the case may be. So anyway, I just had to go on that tangent for a minute because they stole my money, and I get so mad when they steal money. So, or deny the service all complete and tell the patient that they don't deserve the boot when they need it and they have a broken foot or a broken ankle.
How are they supposed to recover? And we just did that episode about the DME that was charging thousands and thousands of boots, but you can't get your boot for a real patient, but they charged 10,000 boots and got paid billions of dollars. So I don't get it. Maybe you're charging too little boots. You need to be charging like 1,000 at a time a week.
Well, and then let's talk about healthcare executives that are listening, right? You can't PR your way out of a credibility crisis. Once the public sees you as the villain, it's going to stick. So fix the processes before the lawsuit starts and do it right the first time. We are here to provide care for patients who pay a premium to obtain health insurance. And again, patients, this is not that they're going to cover everything. You're just paying for a negotiation behind, because you still got your copays, your coinsurance, your deductibles, your out of pockets. There's still all this stuff you still have to pay. But healthcare executives, we need to worry about the patients at the end. You can't see this with just a numbers game. You have to see the people behind at the end.
Yeah. And I mean, can we talk about how this lawsuit, spanned from December of 2024 to April of 2025? And it's basically the entire timeline from the executive's death to the day before the stock tanked. You know what that means, right? It means that lawyers were watching this, and they're watching this story like a hawk, and they're waiting for the receipts, right? And then as soon as it tanked, boom. Oh, now we can sue them. Let's get some more of the people's money that paid for insurance, so that United can deny more claims because we don't have the money to pay for the insurance because we're being sued by our shareholders. And it's kind of like how Donald Trump is suing the United States right now, right, for prosecuting him. You know what I'm talking about?
I can't.
That's like happening. I
can't follow. I'm too consumed with healthcare. I can't.
I'm just saying. I'm like, what is going on? I don't understand. Like, it's the craziest things that are happening nowadays, and I'm like, is this real?
Right. Yes, I know. So it's a full-blown class action in the Southern District of New York. Full-blown. So the company's silence right now, deafening. No comment, no accountability, just Wall Street damage control. Bajillionaires worried about their bajillions, right?
Yeah. And poor Luigi Menegione, he's sitting in death. They're trying to give him the death penalty if he's convicted. And he's become this stark symbol of how angry Americans are at the healthcare profiteer. And let me tell you want to hear a little tea?
Yeah. Oh, tell me.
Girl, he got like 1,000 marriage proposals.
No.
Yes, girl. Like,
he was kind of cute looking. He's not a bad looking.
Honey, people put money on that man's commissary. They say, you need some toilet paper? You need some coffee? Here, a little 50 for you, sexy Luigi. And Luigi be coming to court dressed.
He's Italian. He got to.
Girl, him and his lawyer be looking like they matching. They say, boo, what color we wearing tomorrow? Purple? And they come in there matching. The lawyer says, I am with you all the way. I need that type of lawyer in my life, right? Truly, right? Americans, I think, are tired, and the court of a public opinion is louder than ever. And when no American is mad at Luigi and they say, well, oh, that's why this happened. That's why this happened. It's a very sad day. But United hasn't listened to anybody. And to be honest, they're still not even listening. They're being more shady.
More shady. So sum it up. So we got a healthcare giant. Accused of hiding the truth. A CEO's tragic death, because poor guy. I don't know if it's whatever. Anyway, poor guy. You got $119 billion gone. You have a lawsuit that could expose how far insurers are going to protect profits. You've got corporate chaos basically wrapped in like a true crime bow, like follow the money.
Or a taco. I'm a little hungry, obviously. Not wrapped in a taco enchilada. Okay. And that's today's spill. When healthcare and high finance collide, somebody's always paying the price. But it's usually not the ones in the corner office, honey. You know who it is, Nyleen, all the time. It's the patients.
It's always
the public.
The patients.
It's the taxpayers.
The public. And honestly, and honestly, our good doctors that are trying to do the right thing by the patient. So our good doctors are suffering.
And then they wonder why there's a huge shortage.
Exactly. So stay credentialed, stay curious, keep your receipts, because in healthcare, transparency isn't just compliance, girl. It's survival.
It's survival, baby. And for our patients, check your EOBs all the time. If you don't see something that you had on it, it could be some fraud. So make sure you're always checking your EOBs. Until next time, we'll talk to you later. Woo, that was a whole lot of tea. Who knew doctors had more drama than reality TV?
And if you think that was wild, just wait till next week. We've got more stories, more scandals, and more credentialing chaos coming your way.
And if you love the tea, please don't keep it to yourself. Like to show us you're listening. Please comment and join the conversation, and follow us on LinkedIn, Instagram, and TikTok. Also, share so everyone else can sip with us.
Yeah, so see you next time on Credentialing Chronicles. Stay credentialed, not canceled.